I guess the first thing is, so think about your gut as a river system, right? Think about if you've got a nice, healthy flowing river system, you get nice, healthy drinking water. If something impacts flow for whatever reason, you'll get a buildup of moss and dirty water all the way up through the system. You can chuck chlorine tablets, as many as you like, into that river, but unless you get the flow right, it's not going to get better, right? If you get the flow right, suddenly the water gets better. The water becomes more healthy over time. The gut is exactly the same. If you've got a nice, healthy flowing bowel, you get a nice, healthy microbiome. If something impacts flow, and it's classically the pelvic floor, which I'll come back to, then you'll get a buildup of poo, but you'll also get a buildup of different microbes.
Hello and welcome to the Biohackher Podcast. I'm Azra, your host and founder of Biohackher. I'm an integrative nutrition health coach specializing in longevity for women, a health and wellness journalist, writer, corporate consultant, and a biohacking advocate. Biohackher is a space where we can explore ways to optimize our health to live well longer. Whether it's through improving our nutrition, exercising, cryotherapy, supplementation, technology, and more, I'll be bringing you information and interviews with the best longevity experts to help you understand what you can do to optimize your health, prevent disease, and slow down or even reverse the symptoms of aging by taking control of your unique bio-individuality. Want to know more? Let's dive in. Hey guys, before we jump into the next episode, I wanted to take a quick moment of your time to tell you about the next Live Well Longer retreat that I'll be co-hosting with Camilla Thompson. If you've been feeling the pull to pause, reset, and reconnect with the woman you're becoming, then this is your moment. Join us for the next Live Well Longer retreat, which will be held from the 1st to the 6th of May in 2026 at the beautiful Reviva Resort in Bali. This isn't just a holiday. It's a transformational experience designed to help you reset your biology, restore your balance, and reimagine what aging well truly means. Across 6 days, you'll immerse yourself in restorative practices, nourishing food, movement, workshops, deep rest, and soul-level connection with a community of like-minded women who are all committed to living well longer. It's the kind of retreat that stays with you long after you return home. The clarity, the shifts, the confidence, the reconnection to your healthiest, most grounded self. If you're ready to invest in your well-being and step into a new chapter feeling renewed and inspired, I'd love you to join us. Register your interest now at livewelllongerretreats.com. Spots are limited. Now on to the podcast. Dr. Craig Haifer, welcome to the pod. How are you doing?
Good. I'm going well, Azra. How about yourself?
Yeah, great. Thank you. Thanks so much for coming on to the show. Let's start right at the beginning and tell me what drove you to specialize in gut health.
Firstly, thank you for having me on here. It's been great. I've listened to quite a few of your podcasts and I've been learning a lot from it. So it's really nice to kind of come along on the show. So let's take a bit of a step back. I'm a doctor. I'm a clinical gastroenterologist. When we go through training, you kind of go down our specialty pathways and you kind of in hospitals all the time, seeing all these really kind of sick people. And you kind of start to make these choices about, do you want to go down into more surgical pathways, medical pathways? And you end up finding your feet somewhere along the line. A lot of my family have bowel conditions, things like Crohn's disease, ulcerative colitis. And so that's what really drove me down into gastroenterology. And what's one thing really nice about gastroenterology, it's more than just treating illnesses. We spend our life in med school treating people with illnesses, sick people, and there's so much that can be done in your gut to help prevent illnesses. And that's what's really then, after I finished my specialty training, getting into say, well, how can I not only treat illnesses, how can I help prevent people developing these things in the first place? And actually, more importantly, how can I actually do all these things about prevention? How can I link it all in with whilst treating an illness and let these things work complementary? So it's kind of fell into gastroenterology. And then as I got into it more and more, I realized how valuable it can be to help focusing on the gut, both as treating illnesses, but also preventing it.
That's quite forward thinking of you, because in Western medicine, if I can say, Western medicine has its place and it's great, but it's often very reactive in its approach, where you've just highlighted that you're quite interested in looking at how we can prevent disease as a result of managing our gut health.
It is, and you're right. It's been everything in the wellness world's been prevention, and everything about medical world's been treatment. And even now in Australia, what Medicare doesn't pay for preventative health, it has to be reactive type medicine. And I think that's what's really missing is that can we bring these kind of two worlds together? One just about preventing, but we know that half the population have some sort of a chronic illness. So if we're just talking about prevention, we're missing half the world that we can't intervene with about preventing it because we have to treat it. So what can we do to help bring those two worlds together and do all those really excellent principles that the wellness world has been pushing on? How can we do that to actually work alongside medicine? And that's one of those things I'm really trying to kind of narrow down and try to figure out how best to do it.
Yeah, and there are certainly financial benefits, I think, for the broader community, for the government as well, in taking more of a proactive approach and bringing those two worlds together, would you say?
Yeah, there is. There is. And again, as we talked about, there's so much medicine, pharmaceuticals, hospitalization. It's costly. We know that there's affecting more people. The population's getting bigger. The population's getting older. There's more medical conditions that are coming. The hospitals are already under stress, not just here and overseas. So we say, well, what can we do to, I guess, keep people well for longer and keep people healthy for longer, which means anything you can do will have some sort of benefit down the track. But that involves forward thinking from government, and that we can have a whole nother podcast about the problems with that. But anything, I guess, we can do. There's so much out there, and people want to take control of their health. So anything that we can do to help them along that path, the better.
Completely agree. So explain to us why gut health is so important for our overall health, because I think that we quite often hear that. We quite often hear that gut health is so important. And I think that sometimes it becomes noise that people tune out from. But let's do a bit of a deep dive into why it is so important and the facts and the science behind that.
Yeah. Yeah, it's a really good point. It's often there's so much noise out there, I guess, in social media and everything else. But really, ultimately, we used to think of the gut as completely separate, right? We used to just think about it as nutrition and food for your body to do whatever it needs to do, food for your brain, food for your heart, food for everything else. But it actually really is the control center for the rest of your body. When people talk about gut health, we're classically really talking about the microbiome. And I think it's really important to clarify exactly what that is. So the microbiome, and when people refer to microbiome, they're classically talking about the microbiome in your large bowel, in your large intestines, because a microbiome just refers to a group of organisms. That's all it refers to. And you've got microbiome on your skin, on your lungs, in your everywhere around it. So when people talk classically, they're talking about microbiome in your large bowel. And you've got this whole ecosystem. You've got billions of different organisms that live within your large gut. They all live in harmony. Think of a rainforest. So they're all growing off each other and feeding off each other. Not only do they help break down all food and take the nutrients out of food, but they also produce these things called metabolites, these bits and pieces called metabolites. They will have an impact on the entire rest of your body. So, for example, we hear terms like serotonin, dopamine. These are kind of all things that we refer to in the brain, right? We think about dopamine, serotonin, but actually 90% of it gets made by the organisms in your gut. So, and they have this huge impact on the rest of your body too. And also it's the direct interface between the outside world and the inside world. So something in the outside world will have some impact in your gut will then talk, all those organisms in your gut will then talk to the immune system, which is just on the outside of your gut. And then that will then have an impact on the rest of your body too. So it not just produces all these metabolites and all these things that work around your gut, but it also will directly interfere and control that immune system.
And so you say that the gut is the master controller for so many of those systems, including immunity, hormones, mood, and so on. But for women specifically, what's the most underrated gut hormone connection affecting how we age, do you think?
Underrated. I like it. I think people don't realize that even, say, estrogen is a really important hormone for women. Your liver will turn estrogen into something that can get rid of in the body, right? That then goes into your bowel and would get excreted in your poo. But your gut bacteria, and a lot of those gut bacteria there will actually break down the estrogen and to allow it to be reabsorbed and recycled into your body. So even changes in your gut microbiome will mean less or more estrogen that's actually available for the rest of your body. And that's really, I guess, important. We talk about in women in menopause and kind of postmenopausal type changes. And we talk about hormone replacement and other things, but actually your gut is one of the biggest drivers, or you can consider it as your biggest hormone replacement type therapy. So if you have that healthy microbiome, then that system works really nicely.
And when we're looking at the gut microbiome, and I love the way you described it as a rainforest, how do we ensure that we can maintain a balance between good bacteria, bad bacteria in our gut? Because ultimately, when we do have that dysbiosis, that's is what can lead to illness, right?
Yeah, you're right. It's the hardest thing about it is that often sometimes gets a bit oversimplified. So we talk about good versus bad or pro-inflammatory, anti-inflammatory. Even the term dysbiosis is how do you truly define, in academic world, so how do you truly define what dysbiosis is? It's constantly changing and evolving. And if you think about that rainforest, you will have thousands of different organisms. You can have some nasty bushes that may prick you as you walk past and may give you a reaction. We wouldn't consider them nice things you'd put in your house, but they're actually an important part of that ecosystem itself. And so and that's where where we talk about even things like probiotics, one of the things that it sometimes simplifies is that you can't, even if it's one or two good bugs that do really good things, you can't just have any come back to a rainforest. You can have this most beautiful, spectacular tree, but if it's surrounded by a car park, it's not going to look quite as nice as if it's got that big, beautiful tree as part of a luscious rainforest with all these different things. So it sometimes gets a little bit oversimplified that you can't just have one or two bugs that doing everything. You still need that healthy rainforest. What we do in our life, everything we do from the foods that we eat to the exercise to sleep will have some sort of impact on that gut composition overall. So rather than focusing on one tiny little bit of the gut microbiome, we should think about it as a whole. We should think about it, how do we improve it as a whole rather than try to knock out one thing or try to build one other tree.
Yeah, and when we're looking at that, how do people actually ensure that they can do that? Because often with gut health issues, they may remain hidden for a period of time, or you may become symptomatic. But when you're trying to ensure that you have a healthy gut, what's the best way to approach that?
It's a really great question, and I want to throw back another question at you. Is that often what you said there about a lot of people have gut issues,
Yeah.
and we have to almost think about, should we be treating those gut issues or should we be improving your gut microbiome as a whole as a preventative type measure? And some of those answers have two separate things, and I'll highlight it. Take the FODMAP diet. Okay, let's take a step back. So we think gut troubles. Most people will have some form of bloating, right? We know that over 50% of people have some form of irritable bowel syndrome, and we can argue about the complexities of that. The low FODMAP diet, which was a revolutionary diet designed by Monash University, it works wonders for bloating, but it cuts out all these really good foods that can actually help feed your microbiome. And it doesn't do great things to your microbiome longer term, and it's designed to be reintroduced. So sometimes things that will help your gut troubles or your bloating or your diarrhea or constipation may not necessarily be good to help your microbiome longer term. And so it's a little bit more complex.
Yeah, but how do people navigate that though? Because people may be be told or recommended that they need to go on a low FODMAP diet because of certain symptoms. Yet you've just highlighted that being a low FODMAP diet causes other issues potentially. So where's the balance here?
It is, and this is what I navigate every single day in my clinical practice. And I ultimately spend my life liberalizing people's diet because I think the first thing, treat any intervention to your microbiome like a drug, right? If you go to the doctor with high blood pressure, you get put on a blood pressure pill, you will always have an appointment to see your GP again to check your blood pressure. And if your blood pressure hasn't come down or it's caused you side effects, you're not going to continue that blood pressure pill. But what happens with diet is say, okay, go on a low FODMAP diet or fix your bloating. A lot of people go on the low FODMAP diet that either won't fix their bloating, or the actual impact of being on a low FODMAP diet. They don't know how to navigate their social world with it. No one talks about their bloating or their bowels or poo. No one talks about these kind of things. So what impact does it have on their social life? And that stress around what goes or what doesn't go in their mouth only feeds back into what we call the gut-brain interaction and makes the symptoms worse. So I'd say first things first is be clear with what are you trying to achieve. Are you trying to fix your bloating? Or are you trying to improve your microbiome? Or are you trying to do something different? And have a plan to reassess it. Have a plan to say, has it worked? And if it hasn't worked, you say, well, what's the point of continuing it? Or what can we do to adjust it? Or is it, if it's causing more harm than benefit, then reassess, is it the right thing to be doing?
And obviously, this would be very individual because everyone's going to be reacting in a different way, right?
Exactly. And I think then the other thing is, even if it is helpful, you can start reintroducing those things, and we can go deep into gut troubles and bloating, because there's a lot of things that I always talk to patients about, that diet is only one piece of a very larger puzzle, right? You can do what you like to fix it, but I talk a lot about flow through your microbiome, that gut-brain interaction, and they equally, if not more important than diet. And so if we don't get those right, then you can do what you like with diet. It's not going to get not going to get much better.
Well, let's do that. Let's do that dive into that flow that you're highlighting, because I know that a lot of women that listen to this podcast, one of their primary concerns is bloating, and weight gain or brain fog and fatigue. And so what's driving those symptoms, and walk us through that flow that you think that we need to be focusing on.
This is great, because this is what I love talking about, because you can actually make so much difference in someone's life with some very minor kind of thought processes they haven't thought about before. I guess the first thing is, so think about your gut as a river system, right? Think about, if you've got a nice, healthy flowing river system, you get nice, healthy drinking water. If something impacts flow for whatever reason, you'll get a buildup of moss and dirty water all the way up through the system. You can chuck chlorine tablets, as many as you like, into that river, but unless you get the flow right, it's not going to get better, right? If you get the flow right, suddenly the water gets better. The water becomes more healthy over time. The gut is exactly the same. If you've got a nice, healthy flowing bowel, you get a nice, healthy microbiome. If something impacts flow, and it's classically the pelvic floor, which I'll come back to, then you'll get a buildup of poo, but you'll also get a buildup of different microbes. And that'll exist not just in your large bowel, but also into your small bowel, because your bowel is one long tube from your mouth all the way through to your bottom. So again, coming back to that river system, you get a buildup of different organisms through the small bowel, and that so-called SIBO that a lot of people talk about. And it'll also cause even things like your reflux, your nausea can actually be driven by things down the bottom, because it's all connected in one way or another. If you don't get that flow right, you can do antibiotics, diet, you can do fecal transplants, you can do all these different things which will work transiently. And that's what most people find. These things work for a short period of time and then it gets back. But unless you get the flow right, it will end up back at square one pretty quickly. And so the biggest cause of pelvic floor troubles, particularly in females, is their pelvic floor. And when you think pelvic floor, we think post-babies and weakness, right? That's what the instantly think, your Kegels and getting that strength again and everything else. But actually the trouble starts well before that. Classically, as teenagers, no one likes pooing at school, as a prime time example. So you're holding on to kind of poo, you're kind of clenching that because you're missing those urges. You don't want to go to the toilet when you feel like your body needs to go. Over time, that muscle gets tighter and tighter and tighter and get harder and harder to relax. And if you can't relax that pelvic floor, you lose the ability to feel the need to go to the toilet. You lose the ability to fully empty your bowel, so you don't feel it. So the classic thing is, do you feel empty after going to the toilet? And that'll have that impact on flow. It can also cause bladder troubles, either going to the toilet more frequently and not feeling empty, or things like sexual dysfunction, so pain with intercourse. And it's really, 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 really common. And it's the biggest driver of symptoms, particularly in young females, and it doesn't get better. So after deliveries, after babies, the pelvic floor is weaker. So what does everyone do? They clench harder so they don't have any urinary type troubles or bladder troubles. And that resting tone of that muscle just goes up and up and up and make it even harder to relax it. And that's actually one of the biggest drivers of bowel symptoms. And the good thing about it is that it's fixable. So like any muscle, you can retrain it. As you get older, and we're talking about 70, 80 plus, it's not much of it's reversible, but you've still got this window of opportunity until then. And it's different to other muscles, which is just a straight line going back and forth. It's a little bit more of a complex muscle, but a good pelvic physio can help you retrain that muscle. And even just being aware of some things. It's about not straining the toilet, listening to your body cues. If you feel the urge to go, you go, find somewhere, give it some time. If you don't feel the urge, don't force it. And those kind of things can actually just help flow.
I am absolutely blown away by what you said about it starting back when we're teenagers, can I just say, because
Yeah,
I never knew that. And I think there'll be a lot of people out there that won't be aware of that. And why are we not aware of that? Why is this information, this education not out there for us? Because it's so important. There could be so much prevention done back when you're a teenager,
exactly.
rather than those habits, for want of a better word, continuing to exacerbate as you get older and then ending up with these issues that you've just highlighted.
Exactly. It's such a huge issue. As I said, more than half the female population will have some troubles, and often it'll grumble, and then something will tip it over the edge, and then you'll run into troubles. But there's so many things that can be done, particularly early on. And I've got an 8-year-old boy who won't poo at school. So if my 8-year-old boy won't poo at school, how do you expect a teenage girl to poo at school? And we're trying with our school, trying to just improve the cleanliness of the toilets as a start of things. But there's so many more opportunities that we can intervene.
I read somewhere that you should not spend more than 5 minutes on the toilet. Is that right? Because I know some people, mostly men actually, which is interesting. I know
Quiet time. Yeah.
Maybe that's what it is.
Yeah.
They're just sitting on the loo reading a magazine. But I know some people that will spend half an hour or more on the toilet.
Yeah. And they'll go on their phones and everything else. Yeah.
Yeah. How long does it take you to have a poo, for goodness sake? Seriously. What's going on there?
It is, because if you sit and strain, it doesn't help the pelvic floor. It just teaches it bad things. You get hemorrhoids, more likely to get hemorrhoids. You're not going to feel empty. I think if we take a step back, we say, you think about our whole worlds at the moment. We're all on kind of super drive, right? We're all on fast forward. We're running around before school. We're taking kids to school, dropping things off. Our coffee cup, picking up takeaway coffees and sipping it as we're running along the street or catching a bus. Our body knows what it wants and needs. And it's really, there's a whole concept of interoception, of being aware of what your body's needs are. And if we just slow down that little bit, you can hear and listen to those body cues. And bowel function is one of those really key bits. So we know that overnight, poo enters your pelvis at about 3 o'clock in the morning. In the morning, at some stage, you'll get that urge to go to the toilet. And if you miss that urge, you may not get that urge again until the next morning.
Right.
So you go to the toilet later in the day. You don't really need to go, but you knew that you needed to go an hour or two ago. Your body's not ready to actually pass it. So you're trying to force it and strain it, which is only just interfering with those muscles. So like a lot of those really simple things is saying, well, get up that little bit earlier in the morning, have some sort of hot drink, and it doesn't need to be coffee or caffeine or anything else, but giving that hot drink will just kind of help the bowel start to move. Food's really important too, and getting that bowel kind of moving. And listening, if you get the urge to go, you go. So there was a Queensland government spent a whole lot of money on a campaign, and the campaign was poo at work. Literally, it was a dolphin flying over something. It said poo at work. It was on billboards and things in Brisbane. I don't know if you saw it.
I did not see that one. Dolphin.
I think they missed their mark a little bit, but it was the right idea. I always tell people, they're thrown at work. They find somewhere they don't mind going. It's a little bit out of the way. You listen. If you get that urge to go, you go. Just let it be. Come back whenever you're finished. And if you can't go, don't sit there for too long. Come back when you really need to go.
So the key message there, people, is it's okay to poo at work.
In fact, you should poo at work. Not it's okay to poo at work. You should poo at work. Yeah, or find your throne. Find your throne.
Find your poo throne.
Yeah.
You're going to be nicknamed the poo doctor after this, Craig, right?
I've got two boys. I'm already the bum guy, the bum doctor. There's a whole lot of different things that are there.
Continuing on the theme of poo, how often should people be pooing in a day?
Look, there's no right answer. There's some people's normal are a few times a week. Sometimes normal is a few times a day. It's only a problem if something causes a problem. So if someone doesn't have bloating, pain, discomfort, other issues, then it's not a problem. So everything, and that depends on what you're eating, how you're eating. So there's lots of different areas. So there's no such thing as normal.
Because we often hear that, well, I know that if you go and have to have some sort of procedure, or if you go and see a doctor, they'll ask you these questions. Oh, how many times do you poo a day? And I assumed that was why, that there must be a reason, as you know, that you should be pooing more than once a day
Yeah, no,
because of
it's
those
definitely, you
questions.
don't need, no, and I think there's everyone's normal is different. So it's really, it only becomes abnormal if it's causing a problem to your life.
Let's go back to the microbiome, because I think it's really important to dig deep into that space. You've done a lot of research in that. When we're looking at top protective microbial patterns in people who age well, what are they? Because obviously my podcast focuses a lot on longevity, and I think that gut health is a significant contributor to how well or how badly we age.
Yeah, it's really, and this is something that's changing, and there's a lot of research going into the space, particularly knowing the boom with the longevity field. There was some work actually. I was just after in a little bit of prep this morning. I remembered I wrote an editorial for a Nature paper in one of the biggest journals of the in the world, where they took the microbiome from people that lived to over 100 centenarians, and they looked at their microbiome versus people that I guess didn't age very well. And then what they did, and they showed there was several bugs, and the one that keeps coming up is Akkermansia, which is actually one of the next generation probiotics. So it's a bacteria. And what they did in this paper was they took the poo from those centenarians, and they actually gave it to mice that were designed to actually not have a very short lifespan. And by giving these mice these poo from these centenarians, they were able to expand the longevity. Right. So it's just fascinating. It was proof of concept, because you can't do this in human type studies,
Because
but
people
in
would need
mice you
poo,
can.
right? Well, we're not
Well,
doing
yeah,
it.
well, no, we do actually. We do a lot, and we can do fecal transplants and things.
Yes, we'll
But
go on
this
to
from
that.
exactly. But for the mice, you can breed these mice to only have a very day's lifespan, and you can give them, and suddenly their lifespan extended by 30%. And so there's something in someone's stool that does it. And there's a lot of work going into the place. There's been some recent. I saw an article in the Guardian recently about it as well. And so there's a few bugs that keep coming up, and some of these bugs, we think there are some bugs that truly have its difference. So things like Akkermansia, which I mentioned, which you can actually buy now as a probiotic. Do I recommend it? Probably not. I think you're probably better off trying to focus on the whole gut composition as opposed to a single species. But there's a lot of work going into the space. My feeling is gut is one component of your whole body, right? So I want a nice healthy microbiome, so a nice healthy balanced diet, but we also can't forget about the impacts of everything else that happens on your gut, the sleep patterns, your stress, your exercise, all those really core foundations of a healthy life. Full stop will have all independent effects on your microbiome. So it's more than just what goes in your mouth. Each one of those things will have an impact on your gut.
So let's walk through those other things that have an impact on the microbiome. So if we're starting with food, starting with
Yeah.
nutrition, what should we be aiming to consume to ensure that we're
Yeah.
having healthy microbiome?
Yeah, so lots of high fiber type diet, and remembering not all fiber is equal. Everyone knows about the fruit and veg, lots of fruit and veg, but we need the grain based fiber there too. So I'm a big fan of things like oats, things like psyllium, things like nuts and seeds. All those things and legumes are really good for your kind of gut. If people are looking for a diet, the Mediterranean style diet has got significant amount of data showing benefits of all aspects of life. So whether it be cardiovascular health, overall mortality, mental health, gut health. So, and there's a lot of, I guess, good cookbooks. It's a very, you can see there's even, you can have, it doesn't cut out anything. You can even got the red meat on the top, but in small quantities. And you've even got a bottle of wine next to your triangle. It's everything in moderation. So I really like that kind of style. And so if people are looking for a diet to follow, it's not, it's not cutting things out. It's actually adding all these really good positive things in. And that's something I really talk about is I think long-term diet restrictions are a problem. They cause a lot of stress. And I like to think of encouraging people having a really positive relationship with good whole food. So if you fill it with more things, like I saw something about having a carrot a day can do this, or an apple a day, great. If you have that, it means you've got less time or less calories that you need to consume eating crap or eating in a packaged type food. So fill it positive relationship with good whole foods.
And obviously there would be some caveats around that, that if you're celiac, then you wouldn't be
Yeah.
wanting to consume
Yeah.
gluten and so
Of
on.
course. Of
So,
course. Of
all right,
course.
let's
Yeah.
move on to sleep then. How does sleep impact the microbiome?
Yeah, it's a good question. So, but sleep impacts everything in your body, and I think it's we're becoming more and more realized that how important sleep actually is and good quality sleep is. And I guess it's a lot of all the wearables and things are kind of highlighting how important it actually is for your general well-being. In terms of, we know that all will impact your sympathetic nervous system, your parasympathetic nervous system, and all of that will then have an impact on your gut microbiome. So all of these things individually will have an impact on your composition, but it'll also have an impact on your immune system, and that'll have an impact on your microbiome. It'll have an impact on your ability to exercise, and that'll have an impact on your microbiome. So it's all everything in our body is all interconnected. We can't just fix one and hope for the rest to kind of follow.
And stress?
Yeah, stress is the same thing. It's probably the biggest driver. When we talk a lot, I guess, about parasympathetic, sympathetic type nervous systems and toning things down, and that has that impact has on cortisol production, hormone production. It has so much impact as well individually on your gut. And so we were talked about bloating. It'll also be one of your biggest driver of bloating. And we haven't talked about the gut-brain interaction, but it's everything we do is incredibly linked. And so that will also have a direct independent impact on your microbiome.
You mentioned alcohol before. What are your thoughts on alcohol impacting the gut?
Yeah, it's a good question. Like, I guess anything you put in your mouth can act as a food to your microbiome. We know that alcohol is a sugar-based product. So they'll all have it'll be different nutrition or different feeding different parts of your microbiome. The alcohol that they talk about in the Mediterranean style diet is this very high polyphenol type wine, which has got some anti-inflammatory properties. Most of the wine that we get here is not that. But I would say, again, telling someone to remove it if that's part of their life is a problem, but telling someone to have it in moderation, I think, is something that we can all do. I actually found that things like your sleep trackers and other things else can actually show you how much impact alcohol can have on things
Yeah,
like your sleep
it
and your
does.
gut. And like, I know myself, I wore an Oura ring for a while, and you could see it. I have one glass of wine or a whiskey, and it would impact my sleep instantaneously, even though I felt fine. And so I actually, since wearing that, I've cut back down my alcohol consumption dramatically, but I still will have a glass. It's part of my social world. So, but I'll have it all in moderation.
Yeah, agree, because I wear a tracker as well, and I find that if I do drink alcohol, even if it's just one glass, it's definitely impacts my sleep, and my sleep score will drop significantly. And agree with you about the wines here in Australia. I think the Australian wine companies need to really lift their game and marry up to the European wines, because I went on a trip to Europe this year and I drank wine while I was over there, and it did not impact me the way Australian wines do.
Yeah,
Which
it's a
is
great. And I don't know. I wish I was a sommelier back in my day, but in terms I'm not. But I wonder whether, like, we talk. There's different preservatives that they use in Europe versus here, and I suspect that's the thing that's making the difference, and that actually makes a huge difference with food as well. And we see this all the time. People who can't tolerate much gluten can go to Europe and have as much beer and pizza as they like, and they won't get bloated. And
that was
the
me.
different, yeah, exactly. And it's a really good, and that's the type of yeast that they use and the preservatives they use, and that's actually here in our practice, the best way to think about it, you can go get a lovely loaf of bread from your local bakery. It'll last you 3 days on the kitchen counter before going rock solid.
Mm.
You go get a bag of bread from Coles, it'll last you 10 days before going moldy. And the same amount of gluten content, different preservatives, one will cause bloating, one won't. And so it's more complex than, say, the gluten, the dairy, the other things in there. It's often the preservatives. That's what we talk about, as much whole foods and things as you can. Something lasts longer than it should, looks better than it should, tastes better than it should. It's probably got something there to do it. And that's probably the issue.
Yeah, definitely. And I think that here we have a lot more herbicides and pesticides, where in Europe you buy a lot of your produce and your breads and everything that are organically grown using organic ingredients and made in a very different way to what produce here is that is created and made here in Australia, unless you can go to farmers markets. We found a really great local guy who does beautiful organic sourdough bread using the most premium ingredients. So if you can find those sorts of niche artisan bread makers and so on, then I think that's kind of the way to go, rather than buying bread from the supermarket.
Yeah, I get, and if you can't find it, then even going to the bakery section of Coles as opposed to the middle aisles will do you better. And because they are more fresh, look at the date. If the best before is that same day or that baked that day, then you're going to be better off.
Yeah, definitely. Let's do a bit of a dive into the different types of gut diseases that people may suffer from, because there are lots of people out there suffering from different types of diseases, whether it's celiac disease, leaky gut syndrome, whether it's irritable bowel syndrome. Can you walk us through each of these?
So celiac disease is a completely separate disease, and I think that's really important. So true celiac disease is where you have a immune reaction to the gluten protein, right? It is, even if it doesn't cause, it will cause bloating, diarrhea, but often it won't cause troubles at all. In the past, we only saw it in kids. Now we're seeing it even later in life. I diagnosed a 80-year-old lady unexpectedly last week. And if you have an immune-mediated disease, you'll have increased risk of one, you lose all the villi, all these really important things in your bowel to kind of help absorb nutrients. But it will drive things like osteoporosis. It can increase the risk of cancers, liver cirrhosis, and it is an all or nothing approach. So you have to cut out gluten entirely. Okay. And I think that's a really important thing to separate true celiac disease, and that's proven on blood tests and biopsies, so gastroscopy and little biopsies, versus gluten intolerance, which is really common and causes lots of symptoms, but won't have any of those bad effects like osteoporosis, thinning of the bones, cancer risk, liver troubles. And most people can tolerate some. So we talk about thresholds. So when someone with gluten intolerance, if you give anyone, even with the strongest stomach, you'll give them enough gluten, they'll eventually run into troubles with bloating. Most people's thresholds are down much lower than that. And that thresholds will be impacted. So how much you can tolerate by your menstrual cycle, stress levels, other things in your diet, and over time they'll go up and down. What we try to do is to say, well, what can we bring those thresholds up? So you can generally get away with some, not a lot. Where celiac disease, you can't get away with anything. When it comes to SIBO, leaky gut, IBS, I like to think about they're all talking about the same set of symptoms, but looking at it from a slightly different angle. So we've talked about the gut microbiome, we talked about the immune system. There's always crosstalk between the microbiome and the immune system. There's always this talk. When you have some sort of change in your microbiome, it triggers a little bit of a change in that protective layer between the microbiome and the immune system, and there'll be more talk. Right? There'll be more crosstalk, and that's where the concept of leaky gut comes in. So there's more microbiome talking to the immune system. When you talk about SIBO, or small bowel bacterial overgrowth, you're referring to that same equation. You're just talking to a change in that microbiome. You're talking about dysbiosis or excess bacteria in the gut. When you talk about irritable bowel, you're talking about a set of symptoms, is not actually referring to what's the underlying driver. And in fact, irritable bowel has now been termed disorders of that gut-brain interaction. And that's the other piece of the coin. You've got your microbiome immune system, but then you've also got the vagus nerve, which sends everything back up to the brain. The brain then interprets it, sends messages back down and hormones back down. And it can kick off this very big cycle where you get more messages going back up, more messages coming back down. And you can do what you like with diet, but unless you get that interaction right, you're not going to get better. So if we think about SIBO, leaky gut, IBS, disorders of the gut-brain, if we think about them all the same kind of terms, they classically would cause bloating plus some sort of symptom. And we have to tackle them more than just some supplements or antibiotics or something to treat the SIBO, or more than something to try to break the barrier. We have to look at what the triggers are. Is there stress involved? Is there other things going on in someone's life? We have to talk about what's going on with diet. And we also have to really address this gut-brain interaction. And there's something called gut hypnotherapy that works remarkably well.
Yeah, I was fascinated when I read about that. I've never heard of gut hypnotherapy. And I must say, I had some visuals of somebody sort of standing over the top of my tummy with whatever, trying to hypnotize my gut. But obviously, that's not how it works. Can you explain
Yeah.
how it works?
It's I always tell people, particularly the ones that are a little bit skeptical, I'm like, don't worry, after you're not going to be running around like a chicken or dancing like a chicken being hypnotized. Um, it's so if we know that gut brain interaction I was talking about, that is the hallmark of bloating, really, predominantly is the hallmark of bloating. The same people that made the FODMAP diet down at Monash University developed something called gut hemotherapy. It brings in mindfulness, meditation, and other imagery type techniques, focusing on those symptoms. And it's done over a program of about 4 to 6 weeks. And there are several randomized trials where this is the highest level of evidence you can get in medicine, that it works as well as diet, classically the FODMAP diet, in bloating, pain, and change of bowel habits. And it changes people's life. It resets that link. You can do it with a psychologist or a psychotherapist, and there's lots around. And they've spun out an app. There's a few different apps floating around that can do it. And it works. So we use it really widely. And there's the one that's commonly there is something that we use widely is called Nerva. And that was NERVA. And I'm happy I can put a link in the show notes and things for it. But
That'd be great.
that was brought out of a small group out of Monash University. And it works. And they've other people have validated the data too, and we use it widely. And it's often neglected, and it takes you through. It's 10 minutes a day for 6 weeks, and has this very prolonged benefit even after you stop it.
And so, what does it actually do to the gut?
Yeah, it does a few things. So, firstly, with bloating, sometimes when someone's bloated, they don't necessarily have more gas in their tummy than they did an hour before when they weren't bloated, or the next person to the next to them. What should happen is your diaphragm. Your diaphragm should lift to give your tummy more space. Your pelvic floor, which we talked a lot about, the pelvic floor should relax, and your tummy muscles should relax. And what happens inappropriately is that diaphragm drops, your pelvic floor tightens, it lifts, tummy muscles tightened. So if you think like a balloon, you've got the same amount of air in the balloon, but you're just more compressed down, and that leading to that thing of bloating. So when you talk about dietary changes, it tries to change how much gas is being made. But actually, that gas doesn't change minute on minute. It changes over time. And actually, one of the problems is the mechanics. So one of the ways we think the gut hemotherapy will work is actually getting those diaphragm movements better. And the same reason why things like breath work and other things can help with stress, but it also can help with bloating, is actually getting that diaphragm moving properly. So there's a few different ways it can impact your gut.
So it sounds like it's really activating the parasympathetic nervous system as well, in order for us to be able to relax and
Exactly.
Yeah.
Wow. And it's the way it's the best thing is resetting that link, that gut brain link.
Yeah. In what other ways is that gut brain link important for overall health?
I think for overall health, so I think we've talked to that parasympathetic, sympathetic kind of nervous system. We know that will have an impact on everything from your psychology to your heart to everything else. So it's. I think we sometimes. I like Nerva. I like these other programs as a vessel to kind of help people engage with it. Because if you tell someone to meditate or to slow down or to do breath work, what does that actually mean? You need someone to help often guide people through the importance of it and see the importance of it. And so a dedicated, whether it be through another meditation type app or through Nerva or through one of the other ones, actually enables someone to be taught how to do something. And then I know some of the apps will look at symptom scores or overall anxiety type levels and things before and after. So you can objectively look at things before and after. And that's really helpful to look at what changes over time happens.
Yeah, right. Okay. Now, you have done a bit of work around fecal transplant, which I'm fascinated by. Let's do a bit of a deep dive into that. You pioneered a capsule-based approach. Can you walk us through what is a fecal transplant, and why it's important, and in what situations is it used?
So yeah, I love the conversation about poo transplant, especially around dinner time. It's a fantastic way to bring up what we do. So we've talked all about how important the microbiome is for health. When someone has an illness, we know the microbiome is altered. It's not quite right, and we can do all these things to make changes to it. A fecal transplant is essentially a shotgun approach. It's your universal probiotic, where you take the entire rainforest, that entire ecosystem, from someone who's healthy, and that's through their poo. You do something to it.
And you test that
that
Yeah, these are highly
species?
screened donors. Yeah, these are highly screened donors to make sure they don't have any illnesses, they don't have any troubles. And there's actually, like, if you need a blood transfusion, I can call the Red Cross and get you a blood transfusion. There are actual stool banks that will do this under TGA guidance, the Therapeutics Good Administration, some government guidance legislation about how to screen people. You do something to the poo. So you can eat, traditionally it's liquefied, it's filtered in some way or form to get rid of, to be fair, the chunky bits. We're already into poo territory, so we're gonna go through deeper dive into it. And you give it to the patient in some way or form. So you can do it classically these days. We'll do it via colonoscopy. So you have a colonoscopy, put the camera up the bottom and around the large bowel, and at the very end of the bowel, you put the poo transfer, the liquefied microbiome, into the end of the large bowel, and that'll help repopulate the microbiome. One of the troubles with it, and it really came out of the spotlight for treating this infection illness that kills a lot of people overseas. In Australia, we don't have it as bad as here. It works, antibiotics don't work all that well for it. And fecal transplants works in over 90% of people. A single fecal transplant can get people out of hospital within a day. And it showed the potential magic of this, of the treatment. And so we've been the problem with a lot of other illnesses, we talk about chronic illness. So it means it's not just something that's there for a short period of time. You often need to do repeated treatments, or you need to maintain those changes over time. And so what we did was, and also colonoscopy is invasive, it's costly, there's lots of other problems with it. So what I did my PhD on, we were freeze drying the poo. So the microbiome that we're taking from the poo. So it no longer looks or smells like poo. It comes into a powder. And you can put it into a capsule. So it's a capsule so we were making these capsules, and think about it as your universal probiotics. So we showed that in my research was all in ulcerative colitis, which is a sister disease to Crohn's disease. So it's an immune-based disease in the bowel. And we were treating people, we ran randomized trials to show that just treating the microbiome would put people into remission of their ulcerative colitis. And we were able to give capsules longer term and show that we can maintain that response over time. And that was really exciting because it shows that without any immune type conditions, any immune type treatments, we could get people well from immune-based disease. Personally, I feel it work remarkably well working alongside those immune-based based treatments. So if we treat not just the microbiome, we treat the immune system, we can actually get people so much better, more people well. We can get away with less medications. We can truly holistic and complementary treat it. And that's where I think it belongs in not just colitis, but in other conditions.
And so has it been trialled in other conditions or just in colitis?
Yeah, so there's a lot of work. There's so many studies going on in every condition. So there's work in the irritable bowel. A lot of my research has now gone into the cancer space, and there's some really fascinating work that we're doing, like another group shows. So we know cancer immunotherapy. So our Australians of the Year, Professor Scully and Virginia Long, they developed where you could turn on your own immune system to treat cancer, and it's revolutionized cancer. But there's still some people don't respond to it. And there's some really nice work to show that, say you take someone with the melanoma who hasn't responded well to the immunotherapy, you take poo from someone who has had melanoma that's responded remarkably well, you give it to the person who hasn't responded, and suddenly the cancer switches off. So even though that's an immune-based therapy, there's something in the microbiome that drives it. And we know that if you've got a worse microbiome, you do worse when it comes to any cancer outcome. So anything you can do, what's really nice, you can use it as a treatment, but it also is a fantastic research tool because you can say, well, who's it working for? How is it working? Why is it working? And we collect poo samples before, during, and after, and can correlate with the response. And the idea is longer term, we can use that information to try and make new generation probiotics. So rather than probiotics that may have been from data back in the 80s, 90s when we didn't know what was there, we can make these probiotics that we're hoping that can work alongside everything we do and can really change the game when it comes to various therapies.
So what have been the biggest breakthroughs or surprises from those trials around using FMT?
So I think what it has done, it's confirmed that the microbiome plays such a big role to every part of your body. And I think that's one of the one, and it's often now we don't use it all that often in clinical practice because there's still some issues with cost and access and all these other really important factors from a point of view. But the field is moving so rapidly where we will start to see these new products coming through. And there's some new generation probiotics coming out from the US. We're working on some products that will hopefully be in phase 1 trials early next year. And so there's lots of work going into this. So you're going to see within a matter of time, you're going to have, whether it be treating your blood pressure or treating your depression, treating your bloating, you'll have some base of therapies, traditional therapy, and you'll also have some sort of microbial, some sort of probiotic, some sort of intervention that is done from a probiotic point of view.
What about in the longevity space? Because I have heard biohackers talk about going and getting a fecal transplant with the intent for it to help improve their longevity.
The theory's there. How to prove it is really hard. So that study I talked about before about using other animal models to kind of show that it can improve longevity, that's there. Is it going to be any better than actually just feeding your own microbiome, all these good foods, exercise, all those other factors that are there? We don't know. And the other thing is you can do a fecal transplant, but we know that unless you're able to maintain the new microbiome or to improve all these other aspects of life, we talked about flow, we talked about all these other things, then you're probably going to be back at square one within 6 months. So it's where capsules come into play, is that you can potentially give it a bit more longer term and continuously, so that we may change things and it becomes more cost effective. But it's going to be very hard to prove that it's any better than all those other interventions.
So what I'm hearing is that lifestyle choices still will continue to play a critical factor regardless of what advances the research makes. We can't always just rely on popping a tablet to be able to try to maintain our health.
Exactly. And I guess the same thing I've heard on your podcast as well, is you can't supplement your way out of a bad diet. And I think that's a really important, or a bad lifestyle as well.
Yeah, definitely. What about stubborn inflammation? Because inflammation is often one of the driving factors behind disease as well. What can we do for our gut to try to help reduce inflammation in the gut, but also ultimately in the body?
I think it comes down to saying, well, why is inflammation there in the first place? And we say, well, what is the issue that's missing in your life? And I'm going to come back to that. It's about going back to basics with this, where clearly if there's an illness that needs to be treated, it needs to get treated. Most untreated, like we will see, often you'll see what we call high sensitive CRP, which is an inflammation marker in your body, will often be up in people with what's called metabolic syndrome, where they've got insulin resistance. Is that on that spectrum of diabetes, type 2 diabetes? And you can do what you like to that unless you actually treat that insulin resistance. And that's with diet, strength exercise, sleep, lifestyle, all those things we've talked about. And when you do, you'll suddenly, all that insulin resistance start to float away. Then that's actually a big pull. And so we've got to classify what's causing the inflammation and what are the aspects of your life. It's often not a pill to pop, as we keep talking about. Come back to those kind of basic principles. And try to address little bits of everything, and it seems to work better than trying to do one thing or another.
Probiotics are $1 billion industry. What do people get wrong about probiotics, do you think, and what does the evidence actually support?
Yeah, you're right. It's the key bit there. It's $1 billion industry, and it's based on marketing budgets and not efficacy. And so even if a product has the best efficacy, the ones that you see are going to have the best marketing budget that's there. The regulations around it are a bit of a mess, to be honest, as well. And the way there's lots of different subtypes of different products, and how you can advertise these things as well. Yeah, but there are new gems that are coming from overseas that have got more and more evidence. But again, you won't see a lot about them because they don't have big marketing budgets. So it's a changing space. I'm a bigger advocate for prebiotics. So I think the difference of for pre and probiotics, think about your gut as a garden bed or that rainforest. Probiotics are like chucking a rose seed on that garden bed every day and hoping for it to grow, where your prebiotics are like pouring fertilizer and water on your own garden bed and letting it flourish. And that's probably the best way to think about the two. And like, for example, there was a study recently that was in the long COVID space, so treating long COVID symptoms. And it was all about this probiotic, which you can now buy for a lot of money from overseas. And in the fine print of the papers, all talked about it actually using 3 different prebiotics in addition to the probiotic. And the probiotic was designed because it was a common bug in that particular Asian country population. So it's probably irrelevant to our population. But the prebiotics are probably having more benefit than the probiotics because your prebiotics are feeding the different aspects of your own microbiome. So one of the things that we've been trying to do is trying to find those cheap and cheerful, readily available products like various prebiotics. So we're talking about our fibre. So your psyllium husks, your benefibers, your resistant starch, your inulins, all those, your PHCG, all those prebiotic supplements. So this fibre to feed your microbiome at small amounts. So if you don't need very much of these things, particularly with a good diet, as you're better off using those than a probiotic. However, we know some people with probiotics, some people have benefit in their bloating and their tummy symptoms. But again, it comes back to that. If you're trying something, be clear with what are you trying to achieve, and have that plan to reassess it. Is it having the benefit that we have? If it has, then great. If it doesn't have, then maybe reassess.
What are your thoughts on intermittent fasting and how that potentially supports gut health or not?
Yeah, I think intermittent fasting has several benefits, probably not so much in the microbiome type of space. It can help with things like insulin resistance and overall calorie intake. But in terms of if you're wanting to improve, I'm not aware of any significant strong evidence for or less, and I don't recommend advocate it for people who aren't trying to, say, lose weight or to improve insulin resistance in its own right. So it's not one of those things I would routinely recommend.
We've talked a lot about microbiome today, so there might be people out there wanting to try to understand, well, what is happening with my microbiome? How do I know whether I have healthy microbiome or not? What should people do? Are you an advocate of microbiome testing or not?
Yeah, I look at microbiome testing every day. So patients come with a microbiome test. I also look at them from a research setting where I look at microbiome testing on my couple of days a week when I do academic stuff. And I don't often use it to change what I'm doing to treat a patient. So whether we're treating their illness or whether we treat their bloating, everything that we talked about, the gut hemotherapy, the pelvic floor, I will improve their microbiome regardless. So I'm going to be doing these things regardless, and that'll naturally improve the microbiome. So I don't routinely arrange them for patients, but patients are already engaged by the time they come to see me. So, but I do think sometimes it can be really helpful data point for patients to say, I need to make a change. And where it can be in a piece of paper saying, hey, something I'm doing in my life isn't right, and I need to do something to change it. So I think it can be really useful trigger to change. But if you're already engaged and ready to make those changes, then you wouldn't be guiding. We were routinely changing what you do based on those microbiome testing.
If you don't get a gut microbiome test, though, how else would you know whether there's something going on or not, other than physical symptoms like bloating?
Yeah, I think it's a key bit. So even a microbiome test won't help you diagnose a condition. So you don't need a microbiome test to diagnose even so IBS, disorders of gut-brain interaction, leaky gut. You don't need it to diagnose it. The other thing is, I think also just for your listeners, it's a really important thing is that if something's not right in your tummy, go get it checked out. That's the first thing to do, right? We know cancer rates are going up. We know Crohn's and colitis isn't uncommon. We know celiac disease isn't uncommon. So I think we've talked a lot about what are the impacts and what are the potential drivers, but it's really important is if you've got something that isn't right in your body, that doesn't feel right, go have a conversation with your GP. All it may be is a conversation and say nothing needs to be wrong. But particularly over the age of 40, I've got a very low threshold with any symptoms to do a colonoscopy because we see cancers in young people all the time and we can prevent cancers knowing that cancers don't disappear. We've got this, they start as little growths of polyps in your bowel. Those polyps will grow over time and cancers grow from these polyps. We've got this 10-year window to actually prevent someone getting a cancer, but we need to know about it. So any symptoms, either go get your bowel cancer screening kits that will come in the mail from 50 or go ask your GP or pharmacist from 45. You can either ask for it earlier or just go have a talk with your GP. So if there's any problems that are not right, go get it checked out.
But I did read that there is an increase in colon cancer in younger people now. So while we've got a system in place to try to ensure that people at a certain age will get that test done, and not everyone will necessarily get it done. Some people will just ignore it and throw that test in the bin that they receive from the government. what are the things that people should be looking out for? You say if
Yeah.
something's not feeling right in your body, what could be those symptoms
So
or
I guess
those
what are those
triggers?
the red flags we talk about? We talk about red flags in medicine a lot. What are those things to make us think, is there something more sinister? If you're seeing blood, most of the time bleeding is just from little hemorrhoids, but if you're seeing blood, then get it checked out. If you're getting pain or bloating that isn't responsive to things like a slight change of diet, like a gut chemotherapy, if it's not settling down within, we're talking weeks, then you need to get that checked out. If you're losing weight unexpectedly, so more than, say, what you would expect with whatever change of lifestyle you're doing, if you're iron deficient and it's not related to, I guess, your menstrual periods. But the biggest thing is what I actually find, whether it be young or old people that we find have cancer, most of them have known about it. And most of them have known something's not quite right. And they've sat on it and they've been too busy. They haven't wanted to worry about anyone. And so most people have known something's not quite right. And I think the other difference with this screening is that screening is designed for everyone, regardless of symptoms. So if you've got no symptoms, you have to still be doing those kits. Because all these things, by the time it causes symptoms, is often much more advanced than if we can catch it early at, say, those screening tests. So there's a big push to push those screening tests early. You can access screening like through those kits, even if you have to pay a small amount. If you're under 45, it's not a big amount. Just have a chat with someone. Don't be afraid to talk about your bowels.
You're bridging medicine, the gap between medicine and wellness, and a lot of the work that you were doing. What wellness practices genuinely complement medical treatment, do you think, and which ones make you cringe?
There's quite a few that make me cringe, to be honest. And I've heard it all before. Look, some of the ones that I really like, and what I've done, I guess, in my day life, I sprinkle a bit of psyllium husk in my breakfast every morning, and I sneak it into my kids' breakfast. I know I can control that part of their life, so I can sneak it into there on their cereals, and at least that way I know I've got enough fibre. Good thing about it, kids are going to the toilet regularly, and that's one thing I can control. I hate picking up a takeaway coffee and drinking it on the run. That's I love, and I find it's my 5 minutes to sit down and to think about my own body cues and just kind of slow everything down and kind of as a way. That's kind of one thing that I love to do. What are things that I really hate? Extreme restrictive diets,
Mhm.
particularly when they're not actually having any health benefits and they're causing more stress in people's life. I had a girl, and I see this every week, who was on fairly restrictive diet. I said, look, we should probably start to liberalize. And she burst into tears, she's like, I haven't been able to go out with friends. I've been struggling to go out to my parents and stuff. And I don't know what to eat. I'm getting 25 different advices. And we say, well, let's just try to take the stress out of it. Let's have little bits of everything, start reintroducing it. And even taking that away of stress out of it can make a huge difference. And the other thing is the other thing I hate is a complex detox. The detox diets, the detox supplements, your liver's really good at detoxing itself. That's what its job is there to do. And so, yeah, that's anything with detox. Your body's constantly detoxing. That's probably my other little pet hate.
That's an interesting one because a lot of people do detoxes,
Detox. Yeah, and
definitely.
detoxing from alcohol may be a different thing, but yeah,
Yeah.
liver detoxes probably aren't necessary, particularly if it's costing a lot of money and stress.
So if you were designing the ideal gut longevity protocol, what would it be?
I'd keep it really, really, really simple. I would look at someone's, to be honest, I would look at someone's calendar and make sure they schedule time in for self-care. That may be exercise, that may be going for a walk every day, that could be going for a swim, something that they enjoy doing, so they're more likely to continue doing it. I would make sure you get a high fiber breakfast. Love a bit of grain type fiber, oats, kiwi fruits, those kind of things in your breakfast. I would do that every single day, and then you can be more varied later on. I would make sure that someone gets at least 7 hours of sleep a night. That sleep is so important. And there's probably my core pillars, and some sort of stress management technique, whether it be breath work, whether it be meditation. Some people find exercise is that kind of meditation or some sort of slowing down meditative type practice.
We've spoken a lot about many different gut illnesses, gut issues. For someone who is going through some gut health concerns and maybe feeling overwhelmed, they might be experiencing the bloating, the stress, they might be exhausted, whatever it might be.
Mm.
What do you think, or what's your recommendation for them in terms of the simplest place for them to start to try to address what they're going through?
Yeah, and it is overwhelming. Like, again, we've covered so much in the last hour or so discussing it, and we can talk for hours kind of on end. And there's so much information online that's not great information as well. I would say start somewhere. You don't have to start. Just start with one little thing. One little things can make a huge difference. We talk about breakfast, right? So think about getting one little thing a day, or think about saying, well, look, I'm rushing out the door. I never poo when I need to poo. Let's just slow that down, or do one little thing and they all start adding up. Or reach out to help. Reach out to either your GP, a naturopath, a dietitian, but someone who's going to work with various aspects, a coach. Just start, and so can help you guide through those processes. And that's why I quite like things like your Nerva, like your other things, because they are a structure pro. You don't need to think about what I'm doing tomorrow. It's just something that can help you guide that through it. So start small and start small and start easy.
And just finally, what does it mean to you to live well longer, Craig?
I think it's super important. I look back at my own kind of journey in my own health and my own family's health, and I look at what I want my kids to kind of be healthy for, and I look at patients in the hospital every single day, and they struggle with health conditions, mobility, all these kind of other factors. And if for me, if I can push that off another 5 to 10 years longer than I probably could have maybe in the past with someone else, then that's a win for me, right? If I can stay healthier for longer and be more active and mobile and do all the things I want to do, then excellent. That's the most important thing.
Fabulous. Dr. Craig Haifer, you've been amazing today in providing us some really great insights into gut health and the gut microbiome. So thank you so much for your time today. It's been great chatting to you.
Thanks for having me. It's been great having a chat.
Well, that's a wrap for today's podcast. Thank you for tuning in. And if you'd like to learn more about biohacking, go ahead and sign up on my website at www.biohack-her.com to get a free copy of my 5 top biohacks to get you kick-started. While you're there, you can also check out my blog page for more tips on biohacking. If you'd like to subscribe to this podcast, you can do so on Apple, Spotify, and Google Play. Let us know if there's anyone you'd like us to talk to in particular, and we'll endeavour to get them on the podcast. Until next time, remember to live well longer.